This patient was found to have a large cervical fibroid on ultrasound that was in the upper portion of the cervix. On vaginal exam, you don't see any of this fibroid. It was up inside the cervix a little bit. This new device by Boston Scientific called symphion can be placed in as a diagnostic scope and then removed, and then this product that uses radio frequency then can resect in a closed system, circulating the fluid, the entire mass. This patient had been trying to conceive for months and months and was unable to with irregular bleeding, and was found to have this fibroid. I did speed this up at this point to 2 times normal speed, just so that, or 4 times normal speed, so you would not have to sit and watch it at regular speed. But it is a very fast resection. This took 18 minutes, and this was over 3 centimeters. This area we're operating in right now is the cervical canal. This mass is dilated, a big area of the cervical canal, and at the very end of it, it's in the lower uterine segment where a small portion of the fibroid resided. The vast majority of it was intracervical, and minimal fragments come off of this as I'm resecting it. This mass keeps trying to rotate under my jaws because it's attached with just a small stalk, and that's the reason it kind of flips from side to side. And as long as you rotate this device back and forth and are patient and let the blade do its job, it really just pulls every little piece up inside, and it maintains a nice pressure inside the uterus that matches the patient's blood pressure, and therefore you reduce the risk of infusing saline into the patient through the uterine cavity. As I go, I'm just going to try to resect this in a methodical way, starting from the very furthest portion from the implantation on the side of the uterus all the way to the stalk. And that's what I'm doing here. At the very, very end here, I have a few fragments come off, but the device sucks them back up inside. And as you're going to see here at the end, we're going to be at the lower uterine segment. And then I can use the cautery on this. Since this is using an energy rather than a blade, I can use that cautery on it to cauterize the base of this mass, the pedunculated portion, so there's no bleeding. The patient is able to go home the same day with minimal discomfort, and the whole specimen can be sent in a little baggie. The total amount of fluid used for this entire 18-minute case was only 1,200 cc's of fluid. Everything's contained, and it's easy to know the exact amount of fluid and to send the whole fragments off together to the pathologist. As you see here, I'm sucking those little pieces off. Now I'm going to cauterize. There's a little bleeding there. I'm just going to just a little bit of cautery in that area and rotate it from side to side. And then you'll see the image kind of clean up. And that's the uterine cavity right there. So this attached at the lower portion of the uterine cavity, and it literally dilated the vast majority of the middle of the cervix. Watch this part as we pull back. Right, coming back a little further. See how this whole area here was dilated by this large mass.